My name is Gassia Mikaelian. I'm an anchor and reporter at KTVU Fox 2 News in the San Francisco Bay Area. There are a lot of organizations here that are helping many more people than they normally do. I'd like to speak with the head of one of those. Welcome to the conversation, Karen Hanrahan, President and CEO of Glide Foundation in San Francisco. Thanks for being with us, Karen.
Thanks for having me.
Tell us a little bit about what Glide does.
Sure. Glide is an iconic organization based in San Francisco, but really with global reach, nationally known global reach. We provide services, social justice advocacy, and a kind of spirituality, all mixed together, serving the most vulnerable among us, which includes the homeless population, those who are really the most marginalized. We also count among our clients millionaires and billionaires who are looking for meaning and purpose in their lives. And we bring people together from really diverse areas of the nation, really to kind of find community.
Those of us who live in the Bay Area are sort of on a first name basis with Glide. Your name and your organization means so much. Tell me how your mission has changed in the past couple of months because of the coronavirus.
Sure. So our mission has actually not changed. In fact, if anything, it's really just been amplified. So the growing number of people who need our services, from food to early childhood education to harm reduction, we provide services that are more in demand than ever. We also we have a special kind of unique part of Glide where we build communities, and we're known for treating everyone with respect and dignity and seeing the humanity in everyone, no matter who you are, what shape you're in, what you look like. And the need for this treatment, the need for community is really just growing. And I think what's really changed is how we're building those communities, how we're delivering the services. That's really where it's changed.
Have you been able to track how many more people you're serving now compared to a couple of months ago?
So we have, on an average day, many hundreds of people come through our doors to really meet their basic needs. These are people in crisis. They're struggling with drug use. They're struggling with mental health issues. They're the people around us that you see that are truly suffering the most. And those numbers have only grown. We're watching our lines literally and figuratively get longer. We also have more families that we're serving in different ways. Although we closed our early childhood education center because San Francisco schools closed, as it turns out, more of those families need and want counseling, and more of those families need and want food. Their kids are home, that some of them losing their jobs. So they're turning to us, more families, for more things.
What are some innovative and new ways you're delivering that care? I mean, I think about just food alone. No longer can we all go into the dining room and stand shoulder to shoulder and serve and then sit shoulder to shoulder to eat.
That's right. And I think that's one of the most challenging aspects of trying to operate in this crisis. Glide has been able to maintain its services with very minimal disruption, serving the most marginalized. We are a close-up community. We do stand shoulder to shoulder, both in our dining room. We're known for that. We're known for having conversations between staff and clients and among clients. We have a church that we fund as well, which is a place where people come together for personal interaction. So what we're trying a lot of new things. Our church has gone online, live streaming. There are more people that have joined that community than we've had in decades. For our services, we're having to operate amid the crisis. We're having to spread people out. We're still trying to engage and make it feel like it's a close-up interaction, but from 6 feet apart.
What's been the hardest part of all this for you?
I think the hardest part has been that our heightened awareness that we're dealing with one of the most at-risk populations that there is, and collectively they truly are. The homeless are truly at the highest risk. They've got underlying health conditions, more seniors among us. They live in unsanitary conditions, lack of access to hygiene. So that, combined with the fact that the solutions that are being presented are not enough yet. They're not at the scale needed to really solve this problem and prevent further transmission. So the challenge is operating in an environment where with folks who are at extreme risk. Innovating our programs is not new for us. We're doing it, we're adjusting, we're building new partnerships, but trying to figure out what the right solution is where there's almost, there's minimal testing. So we're not sure where it is among our community. And there are few solutions on the horizon. I think that's really the biggest challenge for us.
I know a lot of people that I talk to, mostly my friends and colleagues at this point, and only on the phone or by text. Everyone says they can't wait to get back to normal. And for some people, that might mean being able to go to Costco and buy 3 humongous things of toilet paper, or being able to take that vacation they were hoping to take in the summertime. It sounds like you are working with people who it's, normal is much farther off and longer away than sort of the general population, and their normal might just be a clean shelter to sleep in and maybe 2 good meals a day. So how would you tell our viewers to maybe adjust their expectations, or perhaps increase their compassion for people they live very close to but might not know that much about?
That's a great question. I think setting our expectations is key. The demand for our services and the services of others, all of our partners, it's just going to grow. So the economic situation combined with the COVID-19 crisis is leading to more people out of work, more people unable to feed themselves, more people struggling on every level: violence, mental health. So we are really ramping up already to provide more of those services in more ways. We are trying to expand our reach more across the city and go to more places where the need is. And I think for people who are in the Bay Area, as well as cities across the nation, this is not going to change. Things for the homeless are unfortunately going to get worse rather than better in the near term. I would like for us to use this opportunity to forge new paths for long-term solutions. And I think there is that opportunity. There's a sense of urgency in the city around helping the homeless. There are new and more creative solutions that we hope get scaled up. So there is hope, and I'm optimistic, but I really would like for people to start to pay attention even more and think about what they can do to help those around them that they see suffering.
I remember hearing from the head of, I think it was the Bay Area Council, and they were focusing on the issue of homelessness region-wide. And this gentleman was asked, what's the one thing that people can do to help? And his answer surprised me, because he said, compassion. Compassion. Just realize that this person you see on the sidewalk, has a mother, has a father, was once held in someone's arms, once, sat at a second grade, desk like we all did. And at some point, his life took a very different turn than yours. And it stunned me, because I thought he was going to say money or, handing out food or something more concrete. But I realized how compassion really is the seed of everything you do and everything you're trying to spread.
Absolutely. And we are, Glide is known for its compassion, for spreading compassion. We're rooted in values of unconditional love, radical acceptance. That's how all of us at Glide live our lives. What I think, in addition or along with that compassion, what I like to ask for from people is for them to think very personally about what they can contribute. For us, my favorite thing is when people come down to Glide, when they come, and I know that's hard in this crisis, but in other times, I like when people get involved. And normally, historically, that's been them coming down, volunteering. We have thousands of volunteers who come, they bring their families, and they become part of our community. I think now with social distancing and the current normal, the new normal that we're in, there are other ways. Think creatively about how you might become involved, part of Glide's community, contribute. It can be financially, it can be through some volunteer efforts at home. And be in touch at glide.org. We have a lot of ways that you can get involved.
And I assume that glide.org is a good place to start if someone does want to contribute money alone.
Absolutely. And we have an emergency relief fund. There's been really an outpouring of support and people who want to help Glide. Sometimes people donating $50, sometimes a bigger matching gift from, for example, the Horowitz Family Foundation gave a gift of $500,000 and matched 10 times other people's gifts for a period of time. And what that allowed us to do was to continue our services and really ramp them up right now, using those funds to remain on the front line of this crisis and serving those who need it the most.
And finally, Karen, because I know you're also speaking to a nationwide audience here, you might have the ear of someone else who runs an organization, perhaps like Glide, maybe a little bit or a lot smaller. Do you have any success story? Do you have just something that was your, just the biggest, sesame seed in your tooth, and then you popped it out and you're like, yes, I want to tell everyone about this? Do you have any successes you'd like to share?
So I think, these days, small successes feel pretty big. I mean, for us, it's a success that we managed to design our programs and continue operating with 0 confirmed cases among our over 200 staff and among the clients who we know regularly come to Glide. I think we've had so many successes, kind of new innovations, figuring out really how to make a difference in the lives of people who are struggling. Our harm reduction team now going out, doing more outreach in encampments, helping people who knew almost nothing about the virus, how to protect themselves. We have little successes every day. They add up to a lot.
Well, Karen, it has been a joy to speak with you. Thank you so much for joining me. Karen Hanrahan, President and CEO of Glide Foundation in San Francisco, really reaching across the nation. Thank you for joining me.
My pleasure. Thank you so much.
Of course. And more information on Glide can be found at coronavirusnow.com.